I want
I'm
you to
pretty
look good.
sure I once went to you when I was in med school with my box of everything I was using, and you were like, nope,
No,
garbage,
no.
garbage, keep, garbage, buy
My favorite thing
Cetaphil.
to do.
I vaguely remember that. And I was like, but. And you're like, no,
Right.
don't bother. Hey everyone, Dr. Darria today, and I am really excited about my guest today. I have with me Dr. Jeff Dover, who I have known, I think, since I was in medical school. He's one of the top dermatologists. He's based out of Boston, and he is here to tell us all of the secrets. So Jeff, just really quickly, many of you have probably heard of him. He's an associate clinical professor of dermatology at Yale University School of Medicine. And since that's not enough, he's also an associate professor of dermatology at Brown Medical School. He's also the director of Skincare Physicians, which is in Chestnut Hill, Massachusetts. He's authored over 500 publications, edited 50 textbooks, and some books that you may know is that he's authored The Youth Equation. I mean, we need to hear more about that. And Skin Deep, an A to Z of skin disorders, treatment, and health. So Jeff, thank you so much for being here.
Well, Daria, thanks. It's a great honor and pleasure. Thank you. We can make people look their best, feel better about themselves. If you look better, you feel better, you perform better, men or women alike. It's not really about vanity. It's really about feelings of self-esteem. So every face has a beautiful part and every person has a beauty inside. And what we try to do is bring that out by some of the laser and technological developments we've made over the years.
Yeah, I love that. I love that. Making them as beautiful on the outside as they are on the inside.
You don't want any 12-hour period to go by wasted. So just think of today. What did you or what did viewers put on this morning to prevent aging and to reverse aging? And when they go to bed at night, what do they put on to reverse the process or slow the process? You don't want to waste any 12-hour period. And right now, if someone doesn't have sunscreen on or an anti-aging product on their skin, they're wasting the whole day and they're getting older looking while they're doing their regular activities, whether it's work or childcare or cooking or travel. So at nighttime, you want to make sure you've got anti-aging products on which work. So you want to make sure they work. They don't have to be expensive, but if you don't do it, it's not going to help. So talking about it and having a counter filled with products doesn't make you look better. You got to put them on.
I feel like I need to step away for a few minutes and go put some anti-aging on. Just everyone excuse us for a second. Let's talk morning routine. Let's talk evening routine. What are the 3 or 4 things that we should all be doing every morning?
Let's reduce it to 2 because we've got some people who are so busy, 3 kids, trying to get ready, get to work, get to school.
You're speaking to the choir. You're preaching to the choir.
Every morning you want to put on sunscreen no matter what. And every evening you want to use something with a vitamin A in it, whether it's retinoic acid, the prescription Retin-A, or tretinoin, or retinol. Those are the 2 bases of all skincare lines. You ask any expert dermatologist, female or male, who knows skincare, they'll say sunscreen in the morning and something with vitamin A in the evening. Patients always say to me, well, what sunscreen should I use? I say, what do you use and do you like it? If they say, I really like it, I never change it as long as it's a 30 or higher. But texture is crucial, especially for women. If they don't like the feel of a product, they will never use it. And if they don't like the scent, they will never use it. So texture and scent are crucial. And of course, you want an SPF 30 or 45 that goes on and disappears. Even the great physical blocks with titanium and zinc oxide, they disappear totally. You should see no mask, no gray pale, none of that whitish.
The white lifeguard look.
Don't need that at all. So that's morning. And it can be a moisturizer sunscreen.
And so can I pause you there? Can you tell us some brands? Because we're always on the lookout. And I really like the mineral protection, especially for myself and for my kids. They do tend to look white. So what are some brands that you really like?
Well, the mineral sunscreen, so people understand mineral means it's got mineral in it and it's a physical block. It blocks the sun. And chemical means the chemical absorbs the UV. And that's how it works. There are a bunch of others. What's nice about La Roche Posay is it's available at CVS and Walgreens across the nation, and not
often at the end of the aisle, like that.
And they have lovely products, and they were voted last year best sunscreen in America by, of all people, Consumer Reports.
All right, so that was morning. Now evening, you said a vitamin A derivative. Tell us more about that.
Right. So vitamin A obviously is a vitamin, and the archetypical product is called Retin-A. That's the trade, or the generic is tretinoin.
Okay.
And it's a prescription. So the one hurdle is you've got to see your doctor Don't have to see a dermatologist. Your regular doctor can prescribe it. It makes dull skin look brighter. It makes thicker skin thinner and finer. It lightens brown spots. It smooths skin. It helps fine lines. It hydrates. So the only reason not to do it is if you're either too lazy or can't get to the doctor, or for some reason you're one of the people who finds it too irritating, in which case you get retinol, which is not as strong. It turns into Retin-A in the skin, but it's not as strong. So Roche Posay makes a beautiful one. Neutrogena makes one of the best ones on the market. ROC makes a great one. These are highly effective. You can tell because they sting a little bit when they go on, and they do all the things Retin-A does, just not as powerful. Okay. So there's your anchors: sunscreen in the morning, and you've got the tretinoin or retinol, some vitamin A at night. If you only have time for two things, that's all you need. And you're 90% there.
How much sunscreen should I put on my face? Everybody asks this all the time.
The more, the better. So people talk about exact amounts, doesn't matter. 2 coats is way better than 1.
Okay.
And put it on, and put on more than you think. If you've got the tube left at the end of the summer, you know you're not using nearly enough. Right.
All right.
And it does run out. So just use it liberally. The more, the better. So most people have time, as we've just discussed. And so the truth is, in the morning, you want to use your sunscreen. But before that, you want to use either a botanical, something that's plant-based, or an antioxidant, or perhaps a different vitamin derivative. My favorite in the morning is CE Ferulic, followed by sunscreen. That's easy. And then at bedtime, you want to use something different than your vitamin A, because if you use 2 vitamin A's, that's like filling a cup of water that's already full. It just spills over. So you like different classes of products. So in the evening, I like a botanical or growth factor. And my favorite is a SkinMedica product. And so that's our favorite 4-part application, not expensive relatively when you consider the benefit. And the truth is, it's so simple and so fast. It literally takes less than a minute in the morning, less than a minute at night. But the tip is keep it on your counter, not in your drawer. If it's in the drawer, you'll never use it, and put it right by the toothpaste so you can't forget.
So it just becomes a part of your routine.
People who are busy, you keep it right by the toothbrush and toothpaste. You think, oh my God, I forgot to. And if you're in bed and you didn't do it, get out and do it. It's that important because you've got 8 hours in bed while you're sleeping and you want to get younger, not older. And they have a product called TNS Essential Serum. I use that at least once every day.
Is your thought on the peels versus lasers? Do you feel strongly, or do you think it depends on your skin and go to your dermatologist and see what they recommend?
Well, peels are making a bit of a comeback, but my feeling is they're sort of like old school, old story. A peel to me is like driving down the highway in a car at 1 speed only. It's either on or off. And neither you nor I nor anybody listening would ever get a car that only went 1 speed. Like 65 is fine on the interstate, but what if you're in front of a school? Like you're going to kill somebody. Right. So peels go on, they work, and then they're done, but you can't stop them for the most part. And we used to do them, but we saw too many side effects, like a lot of side effects. Lasers are the ultimate controlled device. I can set anything I want. The reason they're so expensive is they're very high fidelity. So I can treat one brown spot, big brown spots, light brown spots, spots all over. I can make someone who has brown spots look 12 years younger in a matter of 3 gentle, almost painless treatments. And I can't guarantee that with a peel. So it is remarkable what we do with almost no downtime now. That area of dermatology has been revolutionized in my career. Brown spots, facial redness, facial blood vessels, facial wrinkles, facial sagging, facial laxity, dropped brow, wrinkles. It is remarkable what we do. And when I show patients some of the pictures of patients who allow me to do so, they just say, I can't believe that. Like, this must be trick photography. She must have had a facelift. Of course not.
It's amazing.
It's quite impressive.
So you mentioned lasers and you said other devices. What are those other devices we should be looking out for?
Well, we've helped to develop a bunch of exciting devices. One was called Thermage, or is called Thermage. It's now 10 years in the making. It's a radio frequency device which tightens skin in 5 areas. 1, 2, 3, 4, and 5. 6 months later, 94 to 96% of patients see some tightening, not like a facelift, never scary, never unnatural. And it works beautifully for women and men who are just starting to sag, but don't have a ton of sagging. That's one of our favorite go-tos. And Patients often after 50 will do that every year. Under 50, about every 18 months. I've had 4 myself. I do nothing, but that's one thing that I do. The second is something called the Fraxel, which is a laser, but that helps to make people look like you. Brightens the skin, evens the color, and helps find wrinkles. So a woman as busy as you with kids and a busy life to look this good, that's the secret in Hollywood. When you see 50-year-old women who look 30, you think, what did they do? They did thermometry, they did Fraxel.
Ooh, okay.
And then the third is something called Zeltique, or cool sculpting, which we helped to develop, which is a Harvard patent which uses cold to permanently freeze and destroy fat. We know the minute someone walks in, if they're a smoker, if they're in the sun, if they're not taking care of their skin. If they use the products we mentioned, they walk in, I say, wow, you look unbelievable. They say, no, you say that to everybody. I say, no, I don't.
I don't.
And my nurse said, no, he doesn't.
And it's important to anyone listening, if you haven't been taking care of your skin up until this point, they can reverse damage. Like, make sure everybody hears that. I want everyone to hear that.
I'm glad you brought that up. That's a point that's lost on many people. Smokers who stop smoking, their lungs actually reverse almost to normal as long as it's not been for too long. It always astounded me. The skin can do the same thing. You stop smoking or you stop baking in the sun and you wear some sunscreen. It is amazing how quickly people look better. 6 weeks of tretinoin and you suddenly start to see a glow and the skin brightens. It is very impressive. And then once they see that, they're hooked. Then they want to do a little bit more. Start with good skincare, then you can go to procedures, but the basis is skincare.
So I want to ask you, as a dermatologist, what's the kind of craziest fad you've ever seen anyone try?
Well, fad, I'll tell you another story, but the fads are these home devices that people come in with. I had this patient, very well-to-do Bostonian, very well-known family, a woman about town, philanthropy, theater, opera, music. And she came in with this device that she had bought online, an electrical stimulation device. And she brought it out. She was really proud of it. And she said, what do you think? I said, it's junk. This is junk. You take it. And she slammed it down on the desk. And she said, wait till I bring you the other stuff I have. And the next week she came with like a suitcase filled with all the toys she had bought to make her skin look better. A total waste of money and time. And eventually they cost a lot.
What about those masks that look like hockey masks that are supposed to do something to your face?
Junk.
Junk. See, I told her, now all our audience is like, I see, he really does do that. Now, Jeff, tell everybody where they can go to get more information on you, get more of your nuggets of wisdom.
Whoa, I've given them all away. So
I know that's not true. Anyone listening, he's not telling the truth.
Well, Skincare Physicians is our practice in Chestnut Hill, which is a lovely suburb just outside of Boston near Harvard Medical School. And there's an awful lot of information on the website, skincarephysicians.net. And I've written an awful lot of books, mostly for physicians, but The Youth Equation is a wonderful book which actually teaches people most of the tips that I've mentioned in our conversation today, just in more length. And the A to Z Encyclopedia is a great book, one of the first books I wrote for lay people, which is just an A to Z of conditions about skin that you want to look up, and that's available as well. But a lot of this information is available online. The problem is most of what's online about skin is not true or not vetted. And so you want to speak to people like Dr. Darria, who knows. Here's an unbelievably skilled physician who knows about motherhood, about being a physician, about being beautiful and a woman, and knows what to tell you. So that's crucial. And would you like to go to a store and ask someone for expertise about skincare? Or do you want to ask someone who looks like Darria, who's a physician? I mean, to me, it's so straightforward. Go to your dermatologist, wherever you are in the country. They know more about skin than anybody, not estheticians, not sales clerks, and not throwaway magazines for sure, like the Inquirer or the Next Best Diet to have skin like this, right?
Well, thank you. I should have you write some of our marketing. But Jeff, that's why we have you, because you're the best, not just in the country, I don't think, but I think the whole world at what you do. So everyone, yes, skincarephysicians.net, check out The Youth Equation. Jeff, we'll have you back because I know people are going to have more questions and want more of your tips. So we will definitely have you back.
I'd be honored. Thank you for having me.